Hey everyone, it's Host Name from Medical Digest. Today, we're taking a deep dive into the amazing world of your gut. Well, the gastrointestinal system to be precise. Whether you're studying medicine, curious about how your body works, or just really love food and who doesn't, understanding your GI system is key. We're going to break down all those complex medical terms into easy-to-understand explanations. We'll cover everything from the esophagus, which transports your food, to the stomach, where the real digestion party begins. And of course, we can't forget about the small intestine and the large intestine, each playing crucial roles in nutrient absorption and waste removal. So if you're ready to unlock the secrets of your gut, hit that like button, subscribe to the channel, and let's get started. All right, let's kick things off with the esophagus. Picture this. You're taking a bite of your favorite food. What happens next? Well, after you swallow, that delicious morsel embarks on a journey down your esophagus. This muscular tube acts like a highway, connecting your throat to your stomach. But it's not just a passive tube, oh no. The esophagus uses rhythmic muscle contractions, a process called peristalsis, to propel food downward. Think of it like a wave pushing your food along. Now you might be wondering, what stops food from going down the wrong pipe into our lungs? Well, we have this nifty little flap of cartilage called the epiglottis. It acts like a trapdoor, closing over the windpipe when you swallow to ensure that food goes down the right path. Pretty cool, right? So next time you enjoy a meal, take a moment to appreciate your hard-working esophagus, diligently transporting your food to its next destination. Next, stop on our digestive journey, the stomach. This muscular J-shaped organ is like the ultimate food processor. Once your food arrives from the esophagus, the stomach gets to work, churning and mixing it with gastric juices. These juices are a potent mix of hydrochloric acid, enzymes like pepsin, and mucus. Now you might be thinking, hydrochloric acid? Isn't that super corrosive? You're right, it is. But our stomach lining is designed to handle this powerful acid, which helps break down food into smaller, more manageable pieces. Think of it like this. Your stomach is like a blender, breaking down those large food particles into a smoothie-like consistency called chyme. This process is crucial because it allows our bodies to extract the nutrients we need from the food we eat. But the stomach's job isn't done yet. It also plays a role in regulating the flow of chyme into the small intestine, ensuring that our digestive system doesn't get overwhelmed. Now, let's move on to the small intestine, specifically the first part called the duodenum. If the stomach is the food processor, the duodenum is like the master chef, where the real magic of chemical digestion takes place. As chyme enters the duodenum from the stomach, it's met with a cocktail of digestive juices from the pancreas, liver, and gallbladder. These juices contain enzymes that break down carbohydrates, proteins, and fats into even smaller molecules that our bodies can absorb. The pancreas, for example, secretes enzymes like amylase for carbohydrate digestion, protease for protein breakdown, and lipase for fat digestion. The liver produces bile, which is stored in the gallbladder and helps emulsify fats, kind of like breaking down large fat globules into smaller droplets for easier digestion. So, the duodenum is where the real molecular breakdown happens, transforming those food components into absorbable nutrients. It's a crucial step in the digestive process, ensuring we get the energy and building blocks we need from our diet. Moving right along the small intestine, we arrive at the jejunum, the middle section responsible for the heavy lifting of nutrient absorption. Imagine the jejunum as a long, winding highway lined with millions of tiny, finger-like projections called villi. These villi, in turn, have even smaller projections called microvilli, which increase the surface area of the jejunum enormously. Why is this important? Well, the greater the surface area, the more efficiently nutrients can be absorbed into the bloodstream. Think of it like this. Imagine trying to soak up a spilled drink with a flat piece of paper versus a thick, absorbent sponge. The sponge, with its larger surface area, will absorb the liquid much faster and more effectively. So, as the digested food particles travel through the jejunum, these villi and microvilli work tirelessly, grabbing onto nutrients like carbohydrates, amino acids from proteins, and fatty acids, transporting them into the bloodstream to nourish our bodies. Last but not least, we reach the ileum, the final section of the small intestine. While the jejunum handles most of the nutrient absorption, the ileum isn't just sitting idle. It plays a crucial role in absorbing specific vitamins and bile salts that are essential for our health. One of its key functions is the absorption of vitamin B12, a vital nutrient for cell growth, red blood cell production, and nerve function. The ileum has specialized receptors that bind to vitamin B12, allowing it to be efficiently absorbed into the bloodstream. Another important role of the ileum is the reabsorption of bile salts. Remember those handy helpers from the liver that emulsify fats? Well, the ileum acts like a recycling center, absorbing bile salts so they can be reused by the liver, ensuring efficient fat digestion. So, even though it's the last stop in the small intestine, the ileum plays a critical role in ensuring we absorb those final essential nutrients and recycle vital components for optimal digestion. Now, let's shift gears a bit and talk about some common conditions that can affect the GI tract, starting with GERD, or gastroesophageal reflux disease. We've all experienced occasional heartburn, that burning sensation in the chest, often after a spicy meal or late-night snack. GERD is like heartburn's more persistent, troublesome cousin. It happens when stomach acid frequently flows back up into the esophagus, irritating the lining. Remember that trusty lower esophageal sphincter, LES, we talked about earlier? Well, in GERD, the LES might not close properly, allowing acid to escape back up. This chronic acid reflux can lead to a range of uncomfortable symptoms, including heartburn, regurgitation, difficulty swallowing, and even chest pain. Lifestyle modifications like avoiding trigger foods, eating smaller meals, and managing weight can help. But if you're experiencing frequent or severe symptoms, it's crucial to see a doctor to get a proper diagnosis and discuss treatment options, which might include medications to reduce acid production or strengthen the LES. Moving on to another common GI condition, peptic ulcer disease, or PUD. Imagine developing sores or ulcers on the lining of your stomach, lower esophagus, or duodenum. Ouch, right? That's essentially what happens with PUD. These ulcers can be quite painful and are often caused by an infection with a bacterium called Helicobacter pylori, or H. pylori for short. This pesky bacteria weakens the protective mucus layer of the stomach lining, making it vulnerable to damage from stomach acid. Another common culprit behind PUD is the long-term use of non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen or aspirin. While these medications are effective for pain relief, they can also irritate the stomach lining, increasing the risk of ulcers. Symptoms of PUD can vary, but often include burning pain in the abdomen, nausea, bloating, and even blood in the stool or vomit. If you suspect you might have PUD, it's crucial to see a doctor for diagnosis and treatment, which might involve antibiotics to eradicate H. pylori, acid-reducing medications, or in some cases, even surgery. Now, let's talk about gastritis, a condition that involves inflammation of the stomach lining. Think of it like this: your stomach lining is usually tough and resilient, able to withstand the harsh environment of digestive juices. But sometimes it can become irritated and inflamed, leading to gastritis. This inflammation can be acute, meaning it comes on suddenly, or chronic, developing gradually over time. There are various causes of gastritis, including bacterial infections like H. pylori, yes, the same culprit behind PUD, excessive alcohol consumption, long-term use of NSAIDs, and even autoimmune disorders. Symptoms of gastritis can range from mild indigestion to more severe discomfort, including nausea, vomiting, abdominal pain, and a feeling of fullness, even after eating small meals. Treatment for gastritis depends on the underlying cause, but often involves lifestyle modifications, medications to reduce acid production, or antibiotics to address bacterial infections. Remember the esophagus, that muscular tube transporting food to the stomach? Well, sometimes the esophagus can become inflamed, a condition called esophagitis. Imagine the lining of your esophagus becoming irritated and sore, not a pleasant feeling. One of the most common causes of esophagitis is, you guessed it, acid reflux. When stomach acid repeatedly flows back up into the esophagus, it can damage the delicate lining, leading to inflammation. This is called reflux esophagitis or GERD-related esophagitis, but acid reflux isn't the only culprit. Other causes of esophagitis include infections, allergic reactions to certain foods or medications, and even damage from a foreign object lodged in the esophagus. Symptoms of esophagitis can vary depending on the severity, but often include difficulty swallowing, pain when swallowing, heartburn, nausea, and vomiting. Treatment aims to address the underlying cause, often involving lifestyle modifications, medications to reduce acid production or treat infections, and in some cases, even surgery. Now, let's discuss a more serious condition called Barrett's esophagus. This condition occurs when the lining of the esophagus, normally a pale pink color, changes to a salmon pink or reddish color. This color change reflects changes in the cells lining the esophagus, a result of chronic damage, often from acid reflux. Think of it like this. Imagine your esophagus trying to protect itself from the constant irritation of acid reflux. It adapts by changing its cell structure, but this adaptation comes with a downside, an increased risk of esophageal cancer. While not everyone with Barrett's esophagus will develop cancer, it's considered a precancerous condition, meaning it has the potential to progress to cancer if left untreated. That's why it's crucial to manage GERD effectively and undergo regular surveillance if you've been diagnosed with Barrett's esophagus. This surveillance usually involves endoscopies, a procedure we'll discuss later, to monitor the esophagus for any abnormal changes and catch any potential problems early on. Remember, early detection is key when it comes to managing precancerous conditions like Barrett's esophagus. Let's switch gears again and explore some of the diagnostic tools doctors use to examine the GI tract, starting with endoscopy. Imagine a thin, flexible tube with a tiny camera attached to it. That's an endoscope. During an endoscopy, the doctor carefully guides this endoscope down your esophagus, through your stomach, and into the duodenum, providing a real-time view of the inner lining of these organs. Endoscopy is a valuable tool for diagnosing a wide range of GI conditions, including GERD, peptic ulcers, gastritis, esophagitis, and even Barrett's esophagus. It allows doctors to visualize any abnormalities, take biopsies if needed, and even perform minor procedures like stopping bleeding or removing polyps. The procedure itself is usually performed under sedation, so you'll be relaxed and comfortable throughout. While it might sound a bit intimidating, endoscopy is a safe and effective way for doctors to get a clear picture of what's happening inside your GI tract. Now, let's move on to the colonoscopy, a procedure specifically designed to examine the large intestine, also known as the colon. Similar to endoscopy, a colonoscopy involves a thin, flexible tube with a camera, but this time, it's inserted through the rectum and advanced through the entire length of the colon. Colonoscopy is the gold standard for detecting and preventing colon cancer. It allows doctors to visualize the entire colon lining, identify any polyps, small growths that can sometimes develop into cancer, and remove them if necessary. Regular colonoscopies are recommended for everyone starting at age 45 or earlier if you have certain risk factors like a family history of colon cancer. While it might not be the most glamorous procedure, colonoscopy is a lifesaver, literally. It's one of the most effective cancer screening tools we have, and early detection through colonoscopy significantly increases the chances of successful treatment. Let's step back in time and talk about a classic diagnostic test, the barium swallow, also known as an esophagram. This test uses X-rays to create images of your esophagus and stomach, but with a twist. You'll be asked to drink a special liquid containing barium sulfate. Barium sulfate is a contrast agent, meaning it shows up brightly on X-rays, highlighting the inner lining of your esophagus and stomach. As you swallow the barium, a series of X-ray images are taken, allowing doctors to visualize the movement of the barium through your digestive tract. The barium swallow is particularly helpful in diagnosing conditions like swallowing disorders, hiatal hernias, where part of the stomach bulges up into the chest, and strictures or narrowing of the esophagus. While it's not as commonly used today as it once was, the barium swallow remains a valuable tool in certain situations, providing a different perspective on the upper GI tract compared to endoscopy. Moving on to a different imaging modality, Abdominal ultrasound. Unlike X-rays, ultrasound uses high-frequency sound waves to create images of your internal organs, including those in your abdomen. During an abdominal ultrasound, a technician applies a special gel to your abdomen and moves a handheld device called a transducer over your skin. The transducer emits sound waves that bounce off your organs, creating echoes that are processed by a computer to generate images. Abdominal ultrasound is a safe, painless, and non-invasive way to evaluate your abdominal organs, including your liver, gallbladder, pancreas, spleen, and kidneys. It's often used to diagnose conditions like gallstones, fatty liver disease, pancreatitis, and kidney stones. Because it's quick, painless, and doesn't involve radiation, abdominal ultrasound is often the first imaging test used to evaluate a wide range of abdominal symptoms. Finally, let's talk about computed tomography, better known as a CT scan. CT scans use X-rays, but unlike a regular X-ray, which takes a single image, a CT scanner takes multiple X-ray images from different angles. These images are then processed by a computer to create detailed cross-sectional images or slices of your body, including your internal organs, bones, and blood vessels. In the context of the GI tract, Connecticut scans are particularly helpful in diagnosing conditions like appendicitis, diverticulitis, which is inflammation of small pouches in the colon, inflammatory bowel disease, and even tumors. While CT scans do involve a small amount of radiation exposure, the benefits of obtaining detailed images often outweigh the risks, especially when diagnosing serious conditions. So there you have it. A crash course on the amazing world of the gastrointestinal system. We've covered everything from the esophagus to the anus, explored common GI conditions, and even delved into the diagnostic tools doctors use to keep our guts healthy. Remember, understanding how your body works, especially something as vital as the digestive system, is empowering. It allows you to make informed decisions about your health, advocate for yourself, and engage in conversations with your healthcare providers. If you enjoyed this deep dive into the GI system, give the video a thumbs up, subscribe to the Medical Digest channel for more informative content, and let me know in the comments what other medical topics you'd like me to cover. Until next time, stay curious, stay healthy, and keep those digestive systems happy.